Morning and welcome to POSPA 2. I have Dr. Robin Thomas here with me, the State Suicide Prevention Coordinator with the Louisiana Department of Health, Office of Behavioral Health, and you're here to talk about a helpline.
Yes.
All right, so first of all, how long has this helpline been around?
Okay. So the National Suicide Prevention Lifeline has been in existence since 2005. But
Okay.
on July 16th of 2022, the Federal Communications Commission, they designated a new three-digit code to connect callers quick and easy access to the lifeline. It's a new three-digit code, which is 988. And
Okay.
that was launched on July 16th of 2022.
Okay.
It's
And so tell me a gist of what 988 is.
Okay. So 988 is the Suicide and Crisis Lifeline. And initially, the name was the National Suicide Prevention Lifeline. At the national level, there was a shift to include crisis. So the name was rebranded to the 988 Suicide and Crisis Lifeline to include all type of crisis, whether that's mental health crisis, substance use crisis, suicide crisis.
Mhm.
If someone is struggling with drug, alcohol, substance use, any type of crisis, big or small. Some people may reach out if they're feeling
Okay.
lonely.
Hmm.
Maybe they're feeling sad, depressed.
Yeah.
Maybe they just had a tough day at work, relationship problems. So they really wanted to expand that lifeline to include all crisis. And they want crisis to be self-defined by the caller. So when someone reaches out, they want that individual to determine what crisis means to them because, my crisis may not be the same as your crisis.
True.
So no matter what that is for you, we want to provide early intervention and we want to increase people reaching out for help. We know that you know everyone needs help with something at
Yeah,
some
it's
point,
true. Hmm.
and you're not alone. It's okay if you're not feeling okay,
Hmm.
and if you're not, we want you to reach out to 988. When you do, you'll be met with a caring, compassionate, competent 988 specialist. They're going to listen to what's impacting you at that moment, try to work with you on ways to feel better, and they can also connect you to those local resources in the community.
Okay. 24 hours,
Yes,
free and
24,
anonymous.
absolutely free. You do not need insurance. You can call, it's free, it's confidential, it's available 24/7.
Mm.
Um, there are several options to reach. You can call, you can text, and you can chat.
And you just dial 988.
988. Mhm.
Wow, how simple is that? And this is open to everyone, regardless of age or sexual orientation, LGBTQ.
Yes, absolutely. Regardless of age, regardless of sexual orientation, like you said, I do want to point out that there are specialized lines when you call. So when you call 988, you will be prompted. If you're a veteran, you can press one, and you'll be connected to specialized services for veterans.
Mm.
Um, if you are Spanish speaking, it'll prompt you to press two. If you are LGBTQ
Yeah.
plus under 25, that press three option is for youth and young adults, LGBTQ under 25, and that option is available for you.
Yeah.
If
What is,
none of those specialty areas,
yeah.
fit you, just remain on the line and you'll be connected to a 988 specialist.
Yeah. Why is 988 so important in terms of, risk of suicides? And, what have studies shown?
Yes. So, too many of us were experiencing mental health related distress without support and care that we need. We know that 1 in 5 adults live with a mental health condition.
Yeah.
In Louisiana, 700 people died by suicide in 2022. So,
Wow.
in 2021, over 48,000 Americans, across the US died by suicide. So, that really highlights the importance of having a line that's available that can reach people where they are in their homes, in their communities, and provide that early intervention and hopefully divert from some of those higher level of care, whether that's, going to the ER and diverting from criminal justice response.
Yes. And I know we spoke a lot about mental health concerns and not, regardless of the level of it. We spoke about that. It can be as far as just a relationship problem. But also, what about substance abuse?
Yes. So I do want to point out that our
Okay.
public awareness campaign, we're working to expand the awareness, destigmatize the need for mental health treatment services, and then increase usage statewide. So a primary goal of the campaign is to reach all residents, of course.
Yes.
But we had a focus on some following high risk groups, and one of those risk groups was individuals with substance use disorder. So that is, one area that we are focusing on. The other high-risk groups that we're focusing on are BIPOC, Black, Indigenous people of color,
Mhm.
that including American Indian, Alaska Native. I mentioned the LGBTQ plus sub-network that you can connect to by pressing 3. Service member veterans and their families, and that's that press 1 option. We're also focusing on suicide attempt survivors, suicide loss survivors, and schools K through 12 and institutions of higher education.
Amazing, amazing. So, what have you found? Because I know we said anonymous. A lot of people feel like, okay, now my name is in the books.
It is anonymous, it's confidential. Um,
Okay,
yeah, when you call, if you are calling or texting, they will have your phone number, of course. If
okay.
you're chatting at 988lifeline.org, they will have IP address.
Mhm.
But other than that, you're not required beyond that. They will not know who you are or where your location is.
Mhm.
I want to point out that
Okay.
the purpose of the call, is not to collect information, it's to provide an intervention. So the only time, information would be collected would be maybe over the course of that call, or if
Mhm.
the 90-day specialist needs to save a life in that moment, or maybe they may need more information to connect you to further resources, and also for us to evaluate the quality of the services that we're providing.
I like that when you said to provide other resources. Will they provide you with that kind of information as opposed to just having that conversation with you? Will they say, here are some resources?
Yes, I would like to point out that 98% of the time when people reach out to 988, all
Yeah.
they need in that moment is that intervention for someone to listen to them non-judgmentally. A lot of times they don't need those additional resources in that moment, but it is there, it's available for you. Those local crisis centers that we're connecting you to, they are familiar with those local resources. They will connect you. They will also offer you follow-up. They'll give you the opportunity to check in on you and to see if you made that connection
Mhm.
to that referral source. Um, so,
Nice. I think we did a good job here, huh? I think we did a
yeah.
pretty good job covering anything. Is there anything that I may have missed that you want mentioned?
In terms of data, when we were speaking earlier,
Mhm.
I did want to mention that we also are focusing on parishes with high rates of suicide. So that is also a part of our public awareness campaign.
All right. Dr. Robin Thomas, State Suicide Prevention Coordinator with the State Department of Health, Office of Behavioral Health. We thank you for joining us this morning. 988, you can access that by on your phone, 988.
Yes.
Another way.
You can chat 988 at lifeline.org.
Okay.
And
And
yeah,
go ahead.
call 988, text 988, or chat at 988lifeline.org.
We thank you. Thank you very much for joining us.
You're welcome. Thank you for having me.
And you're welcome. Stay with us. We'll be right back.